Have you ever thought that going for every health test is the safest choice? What if I told you that, after 70, some of the most common medical checkups may actually put your health at greater risk than skipping them? You may believe you're being proactive, but these procedures, while routine, can sometimes lead to overdiagnosis, unnecessary surgeries, or even emotional trauma. In this video, we reveal 5 medical checkups that seniors over 70 should think twice about, backed by real science and expert warnings. Stick with me to the end, because the last one on this list is often misunderstood, yet it's one of the biggest sources of harm for older adults. Knowing this could save you pain, stress, and even your independence. This channel is about truth, not trends. So if you appreciate science-based, compassionate advice for aging well, consider subscribing and liking this video. Now let's dive into the 5 health checkups seniors over 70 should avoid, or at least question, before saying yes. 1. Colonoscopies. After age 75, the hidden danger. Colonoscopy is a test most of us are told to get regularly, especially after 50. It's used to detect colon cancer early. But here's what most people don't know. After age 75, the risks can outweigh the benefits. According to the U.S. Preventive Services Task Force, routine colon cancer screening is not recommended after age 75 unless there are ongoing symptoms or a strong family history. Why? Because the procedure is invasive. It requires full bowel prep, anesthesia, and in some cases, sedation. That's not easy on an aging body. For seniors, this process can lead to dehydration, dizziness, blood pressure drops, and even kidney damage, just from the prep solution alone. And here's the real kicker. Studies show that detecting and removing slow-growing polyps at this age doesn't always improve survival. In fact, many polyps never become cancerous. Instead, removing them may lead to complications like bleeding, perforation of the bowel, or infections. Let me tell you a story. Mrs. Thompson, 78, was healthy, active, and sharp. Her doctor recommended a follow-up colonoscopy. After the procedure, she developed a perforation, leading to emergency surgery and 3 months of recovery in rehab. The polyp they removed? It was benign. Colonoscopies can be life-saving, but at a certain age, the harm may outweigh the help. Always talk to your doctor about alternatives like a fecal immunochemical test, FIT, or if you even need screening at all. 2. Prostate cancer. Screening, PSA test. The stressful spiral. Gentlemen, this one's for you. The PSA blood test for prostate cancer is one of the most overused screenings in men over 70. While it sounds simple, a little blood test, it often leads to a dangerous chain of events. Here's what happens. A slightly elevated PSA result causes alarm. The doctor recommends a biopsy. The biopsy causes discomfort, bleeding, or infection. If cancer is found, even if it's a slow-growing type that would never have caused harm, doctors may push for surgery or radiation. And here's the truth. Over 70% of prostate cancers found in older men are so slow-growing they would never become life-threatening. But treatment can cause serious side effects: incontinence, erectile dysfunction, and anxiety. All for a cancer that may never have progressed. A report by the American Urological Association advises against PSA screening in men over 70 unless they're in exceptional health. Remember, living longer isn't just about finding cancer. It's about preserving quality of life. 3. Annual full body scans. More harm than good. Full body CT or MRI scans sound impressive, like you're doing a thorough check of every organ. But here's the problem. They often detect things that don't matter. Incidental findings, called incidentalomas, are extremely common. These are harmless nodules, cysts, or spots that cause alarm, leading to more tests, biopsies, stress, and sometimes surgeries you never needed. The radiation exposure from CT scans alone can be harmful over time. A single full-body CT scan delivers a radiation dose of up to 12 millisieverts. That's the equivalent of about 200 chest X-rays. And again, studies show that in adults over 70, early detection from such scans rarely changes outcomes, but often worsens anxiety and can lead to complications. Dr. H. Gilbert Welch, a health policy expert, says this: more screening leads to more overdiagnosis, and overdiagnosis leads to overtreatment. Instead of scanning everything, focus on targeted screening based on symptoms, history, and your doctor's advice. 4. Bone density tests in frail seniors, a trap for overmedication. Osteoporosis is a big concern in older adults, especially women. Bone density tests, DEXA scans, are used to measure the risk of fractures. However, if you're over 75, already on bone medication, or very frail, repeating these scans may not change your treatment plan, but might lead to unnecessary drugs. For example, many seniors are prescribed bisphosphonates like Fosamax or Boniva. These medications can help, but also carry serious side effects, including jaw decay and esophageal irritation. In very old or frail patients, fractures are often due to falls, not just bone strength. So focusing on balance, muscle strength, and preventing falls often does more good than pushing more medication after a DEXA test. Dr. Laura Esserman from UCSF says, bone scans in the very elderly too often lead to prescriptions that don't meaningfully extend mobility or prevent fractures. So unless your doctor is using a scan to reassess a major change in treatment, think twice before saying yes to another DEXA test after 75. 5. Routine cardiac stress tests. Without symptoms. Risky and unnecessary. If you've ever been told to just get your heart checked with a treadmill or nuclear stress test, even if you feel fine, this one is for you. These tests are often prescribed before surgery or as part of annual wellness checks. But in seniors without any heart symptoms, they often cause more harm than good. Why? Because a stress test can show blockages that aren't causing problems, and never would. But once found, they often lead to angiograms, stents, or even open-heart surgeries that might not improve survival or quality of life in older patients. A large study published in JAMA Internal Medicine found that stress tests in seniors without symptoms did not reduce the risk of heart attack or death, but did increase the rate of invasive procedures. Dr. Rita Redberg, a cardiologist and editor of JAMA Internal Medicine, explains, just because we can test doesn't mean we should. So unless you're experiencing chest pain, shortness of breath, or other heart-related symptoms, there is no need for a stress test after 70. Let's quickly recap the 5 health checkups you should think twice about after 70. Colonoscopy. May lead to complications without improving outcomes. PSA test for prostate cancer. Risk of overdiagnosis and harmful side effects. Full-body scans. Often detect harmless findings, leading to stress and unnecessary procedures. DEXA bone density tests can result in overmedication with limited benefit. Cardiac stress tests. Without symptoms, can lead to invasive interventions you may not need. Remember, after 70, healthcare is not just about catching everything. It's about protecting your independence, dignity, and peace of mind. Always have an open conversation with your doctor. Ask, will this test change what we do? If the answer is no, maybe it's better skipped. If you found this video helpful, please give it a thumbs up. It helps us reach more seniors who deserve honest health advice. Comment below, which test surprised you the most? Or share your own experience. Your story could help someone else avoid unnecessary harm. And don't forget to subscribe to Senior Rescue for weekly videos on senior health, independence, and smart aging. Thanks for spending your valuable time with me today. Until next time, stay sharp, stay safe, and stay empowered.